So today we're going to discuss a pretty timely topic. We're going to be discussing concussions and post-concussion syndromes. I would say concussions and, more importantly, post-concussion syndromes. I'm Dr. Rutherford. I am a chiropractor, 36 years, and I am a certified functional medicine practitioner. And this is my colleague,
Dr. Reno Gates. I'm a chiropractor as well as being a board-certified chiropractic neurologist.
And we have established a practice that has kind of evolved into a chronic pain practice, treating a number of different difficult conditions, peripheral neuropathy, chronic fatigue, and the practice has kind of evolved on its own, and it has evolved so relative to us starting out with fibromyalgia and developing certain procedures for that, and then finding out that all of our fibromyalgia patients had peripheral neuropathy, well, half of them, and got into peripheral neuropathy. Eventually, we started to understand the brain's function in all of this, and Dr. Gates particularly is a board-certified chiropractic functional neurologist who brings a very unique perspective to chronic pain. In that evolution, it was obvious, or maybe not obvious, but we naturally ran across people who had concussions, post-concussion syndrome, that in some areas were isolated in the sense that their symptoms were from that, but they thought they were from somewhere else, or people who, not unlike myself, who has had 8 concussions that I can remember, mostly from sports, one from my head going through a windshield. But we're having a variety of symptoms that are actually coming from that, as well as several other things. So, so we became more and more interested in concussions and post-concussion syndrome, and Dr. Gates did a substantial amount of research on it. We've had the opportunity to treat post-concussion syndrome now, I would say fairly successfully. I think that would be proper. I think that would be legitimate, and it's a fairly timely topic. It's a controversial topic. I think it's controversial, and I think you're going to find out why here in a few minutes. I think relative to maybe the fact that we now have acknowledged the NFL has really brought this out. The National Football League has brought this out, and there's lawsuits, and they're suing because they're either not getting compensated properly to have it taken care of, or there have been some suggestions that the NFL knew that there was problems with concussions and they covered it up, or there have been famous coaches who are known for continually sending their players back in after they walk off the field. They don't know where they're at, they don't know what day it is, and so on and so forth. So it's a fairly timely topic. The NFL is working with President Obama. I think just within the last couple of months, he had some like the concussion conference at the White House or something like that. And so it's very timely. We thought that we would share with you our findings on these concussive situations and maybe some of the inconsistencies, or maybe some of the lack of research out there, for lack of a better term. And I will defer to Dr. Gates on that, since he's the one who's been looking for the research, finding that it's not really there, and sharing with you who have, and man, I mean, let me just say this, before I ever got into functional medicine, I was treating a lot of people who had concussions. People who had concussions from motor vehicle accidents who didn't know that they had concussions. They would come in, they'd have a whiplash, if you will, and maybe for the first couple of days, or maybe for the first month, they say, you know, I'm a little dingy, I forget a little bit when I walk into a room, and I can't find I forget why I walked in there, or I need to find some words and I can't find them, and I'm a little forgetful, and they don't look the same as they did when I saw them before. They're kind of, you know, and I say, you have a concussion. Oh no, I went to the ER. They told me I was fine, and so on and so forth. So we should bring a little clarity to that. The fact that how many people really are walking through this life who haven't gotten in some sort of whiplash, or hit their head on something, or slipped and hit their head on the concrete, or banged into a beam that they didn't see, or something, and then felt a little dingy for a few minutes, for lack of a more, I'm going to leave the more scientific terminology to Dr. Gates here. But for all of you out there who have concussions and are interested in this, you should know that it's really common. I mean, we have found it to be really common in your neurological exams and in contributing to a vast array. I mean, the NFL guys don't even know about this yet. If they knew about this, wait to see the lawsuits that would go out there. But a vast array of neurological symptoms and problems, and so these are the things that we'll cover. But primarily, we'll start out with concussion. Would you like to offer a few of the thoughts that you have on concussion? Some of the things we were discussing before we got on here, because I thought that was really interesting. Those of you who watched several of our videos will say, that guy says he has everything that you guys treat. He will verify that I do. And that's kind of how this whole thing evolved. I remember when Dr. Gates first came with us about 5 or 6 years ago, and I said, I want you to examine me. And you started to examine me. I could tell in his eyes, he's a very polite gentleman. He's like, he didn't want to tell me, man, your brain is really messed up. You can see him doing the neuro exams and so on and so forth. But it's comforting. I can speak as a patient. It's comforting to have gone through that and to understand what's going on and what's what relative to things that I have been experiencing. And also we'll ultimately talk about treatments that have evolved from your mentor, Dr. Carrick, and some of the things you've put together. So I think if you have a concussion, take the time to listen to this next 30 minutes or so. So maybe a few thoughts, and then into what is a concussion, and go from there.
Absolutely, yeah. And I'll just clarify one thing. I'm a board-certified chiropractic neurologist, and we do what's termed functional neurology. That is, you referred to me as a chiropractic functional neurologist. I did. And so Dr. Carrick, who invented this field of neurology for chiropractors, it's really termed functional neurology.
And I mess it up because we are certified functional.
You are, exactly. You and Dr. Ketchum.
I am.
Yeah, and so basically, relative to what is a concussion, it's where, as most of you know, there's some sort of trauma to the head that causes either compressive forces to the brain, shear forces to the brain, or tensile forces, which just mean the brain either maybe slaps against the skull, or there's a rotational aspect where the brain is compressed, and then there's shear and tension forces.
Like a car accident.
Like in a car accident.
A lot of people say, well, how could I have a brain injury or a concussion when I haven't hit the windshield?
Right.
Because your head goes like this very quickly, like in 1/200th of a second. Your head does that. And it's in a little bit of a fluid. Dr. Gates talked about the tensile mechanism, and your brain hits the skull, even though it's in that fluid. So you don't even have to. You have to smash your head up against the wall or the floor or another helmet of another offensive lineman to get a concussion.
And lots of times it can be what's termed a contra-coup injury, where if your brain goes this way, or let's say you get hit over here, your brain moving to this side of your skull actually is where your brain gets injured.
Right.
And so that is really the mechanism of a concussion, and then it's all about how do we diagnose a concussion. And really, with concussion, it's in a continuum of basically grading head injuries. There's something called the Glasgow Coma Scale, which basically evaluates someone after they have had a head injury. We have a gentleman right now who flew to see us, and he had a pretty significant head injury, basically fractured his skull. He had hematomas all over his brain. He was unconscious for a long period of time. That's an example of a severe head injury, whereas concussions are more on the other end of the spectrum, where lots of times there's not a skull fracture, but the person has neurological symptoms, and they may not be as severe as somebody who's fractured their skull. So those symptoms can be graded in essence, and we really look at the person's orientation as well as memory immediately after having a concussion. We're going to get into some of the concussion assessments here. And also balance tends to be very affected in concussed patients. Lots of times postural stability, reflexes are just not there because the brain has been compressed or moved around so much that what we term as the subcortical or non-cognitive parts of the brain really go offline as well. We'll get into that a little more as we go on. That's what I'd say. What is a concussion?
Okay, and you know what? And I was kind of interested. Maybe we're going to go into that. was kind of interested in. I thought it was very interesting. We chat before this, kind of see how we're going to go about it, and there's the kind of the confusion between we now acknowledge concussions.
Okay, yeah, let's talk about that.
And yet we're not really all that conversant on post-concussions relative to treatment.
Okay.
And maybe the lack of current medical literature on it. That whole conversation was, as a concussion sufferer, that was very interesting to me.
Okay.
I have to think it might be interesting to some other people because they may have the idea people know what concussions are and what to do with them and so on and so forth.
Yeah, so really, as many football players or soccer
we don't have
players
to get controversial about it.
are
What you
aware,
said is just the facts.
I mean, the facts are there wasn't a lot of knowledge about concussion up until very recently.
I can say myself.
Right.
I'm
Just
playing
grab your
soccer.
experience. Yeah.
I'm playing soccer. I get kicked in the head. I'm completely laid out. I mean, totally unconscious. I said I went up in the air. I came down. I looked like a sack of potatoes. They wait for like 20 minutes. Like I'm out for 20 minutes. That is 1970s. Okay, early 70s. And they.
It's amazing you lived.
And then. Right, and then they take me over to the sidelines, and they say, because this was a regional championship game, so it was an important game, and I was the goalie, right? And so the game was important. I was blind. I literally couldn't see. I could barely make out figures running around. They asked me what day it was. I had no clue. They asked me friends about my girlfriend. And that was a bad thing they asked me because my girlfriend was standing right there, and I don't remember anything. They asked me the whole thing. I didn't know anything. They said, okay, well, when the game's over, then we'll see how you do. Now, I'm not going to go into the whole story because it's very long. But the bottom line was nobody figured out that maybe I needed to go to the hospital for several hours. And then I went to the hospital, severe concussion, changed my whole life. I had amnesia for the next 6 months. I had migraine headaches for the next 6 months. I never knew that the balance problems I had were relative to that at that point in time. And now it was a while ago, but still bring that forward until not that long ago. And we really weren't aware of what was going on. I mean, you got these guys in the NFL, I mean, they're getting their bells rung, and they're walking around, and they're like, they don't know where they're at, and they can't articulate well, but they're guys, they're big, heavy, massive, I shouldn't say heavy, big, massive, strong guys. They're going back in there. And again, that was part of the culture when I was a kid. Hey, get up and go back in there.
Right.
Don't be a weak.
Right.
Go back in there.
Exactly.
So we didn't realize the damage that was being done, and it's a lot. It's a lot.
It is a lot.
So we only know now.
Yeah,
really
and
just recently.
It is really a recent phenomenon. I think one of the landmark things that really came out, and we attached a bunch of articles to today's broadcast. One of the articles was from I think she is a female who discovered what is termed chronic traumatic encephalopathy, which is where they're seeing that patients who have had multiple concussions, I believe they were football players and maybe one was a hockey player, have the same brain degeneration pattern as people with Alzheimer's. And that was really landmark. It came out in the New Yorker, I think, in 2009. I remember reading the article. And it was in the New Yorker. It's more of a lay magazine, but they're talking about the science behind this whole process. And so before that, as Dr. Rutherford alluded to, and as I experienced when I was playing football, you get knocked around, hey, you're okay, get back out on the field. And so many athletes have had that experience because the long-term effects of concussions were really not known and even possibly semi-poo-pooed by the scientific community.
And that's what I hoped you were going to bring out.
And really, there's this one neurological textbook. There are many out there that obviously I had to go through, but there's one I really liked, and the author just did a fantastic job of just really elaborating on the nervous system and various neurological disorders and his experiences in neurology. But when it came to this whole topic of head injury and post-concussion syndrome, boy, he was tenacious in his opinion about how, this is just a bunch of crap, basically, and how these people are just attention-seeking. They're histrionic, those who have post-concussion syndrome, and how basically they're just trying to get medical legal gain from their head injuries, basically to get money. And that was, in my opinion, a kind of a prevailing theory or feeling in neurology. However, as of late, now that we acknowledge this concept of chronic traumatic encephalopathy, now the American Academy of Neurology has taken this concussion issue by the horn, so to speak, and they're really trying to make people more aware of concussions, and they're also trying to figure out treatments, along with our current president, on how to better treat post-concussion syndrome patients and so on and so forth. However, what you need to realize is the concussion patient is that a lot of the literature is just not there yet on treatment. Right. If you do a PubMed search for post-concussion syndrome treatment, I mean, it's really
wait and see.
It's wait and see at this point.
That's what I was told.
Yeah, and basically
It'll go away.
Right, and they're trying a variety of things. Hyperbaric oxygen therapy, it looked promising. Now they're saying, oh, it's no more effective than anything. They're trying, a few antioxidants. There's really not a lot out there at this point, and that's why I think President Obama dedicated whatever it was, however many millions, to the study of concussion.
A month or two ago.
And then, the NFL has partnered with the American Academy of Neurology and CDC on dedicating those funds. But again, basically, the research is not there at this point for the post-concussive syndrome patient. And you need to know that there are still authors out there in the literature saying that post-concussion syndrome is basically crap. Right. And that these patients are basically hysterical, especially in the pediatric population. Gosh, we had a gentleman come in here who was a high school football player, and they went to some of the top neurological facilities in the country and basically told that he's depressed. When this kid had 2 concussions, I think, in like a week. And I laugh because it's laughable in terms of somebody giving that diagnosis for a kid who was completely normal and extremely high functioning to then not being able to go to school and not being able to be outside without sunglasses on.
Had post-concussion syndrome.
Yeah.
And so, okay, so folks are looking up concussion for a reason. They probably are wondering whether they have it or somebody has it. How do they identify it? How do they know if they have concussion, or how do you identify it? How do you want to go about that?
Basically, if you have a concussion, first of all, if you have a head injury, I may step on some toes here, but you need to see, as they term in the literature, a licensed healthcare professional who deals with head injuries. Mm-hmm. You need to get a neurological examination. You need to have somebody who knows what they're doing relative to figuring out, hey, does this person maybe need a CT scan? Is it so severe, your neurological injury, that possibly you have a bleed in your brain? Or is it possible that you're going to get a bleed in your brain that's going to develop over 2 weeks and lead to some neurological impairment? That's number one. And then number 2 is, if you're just, let's say it just happened, you're on the sideline, you want to have somebody evaluate you. Basically, those evaluations consist of looking at orientation. Where are you? What's your girlfriend's name? What's the date? What county are you in? What year is it? And then also memory. So you can just give people memory tests. Give them 5 nouns and say, okay, recite these back to me. Give them 3 nouns and say, remember this in 3 minutes. Tell me back in 3 minutes. And so basically, you can have them recite phone numbers. And if you look at the standardized assessment of concussion tool, which is being recommended for athletic trainers and sidelines people, basically it's just a way to quantify, can a person remember, are they oriented to where they are? And basically they're also saying that if you have a concussion, you probably want to take all of your athletes before there's a possibility of concussion and do these tests with them then, so we have a baseline, and then if they develop a concussion, you can go back and say, oh, you scored a 30 out of 30 the first time, and now you're a 20 out of 30. Something wrong.
And that's all good, and that's the way it should be worked up. But for those people come in that I'm evaluating, and people I've evaluated for years with, I mean, if you just feel off, and again, I want to go back to, we keep referring to the football thing because it's current. Okay, but yeah, I mean, you can be, I've had patients who come in and they were in a house that had a low beam, they went to move up, boom, they hit the beam, and they say, I just haven't felt like myself the last 4 or 5 days, and I just feel off a little bit. My memory is just a little bit off, or my balance is a little bit off. If you just feel off, and you have just hit your head, just know you, at the very least, probably have a mild, what they call a mild traumatic brain injury, which is something that you may want to be attentive to. If you start, like for me, now it was a severe injury I had. It changed everything. I literally lost my math skills overnight. They literally disappeared. Now that is extreme, okay? And that's a little bit more obvious. But it wasn't obvious to my coaches immediately,
Right.
but it was obvious later on. But if it's like subtle, just you start, you've had a good memory, you don't have a good memory. All of a sudden you can't catch your words. All of a sudden you have a little bit of like balance problems or these types of things. And you've just hit your head in the last 24 hours or 72 hours or a week or two, you should go get that checked out. And determine whether there's an issue there, and then maybe explore some of the methods that we're going to talk about further. So, all right, now,
and I didn't really hit post-concussion syndrome. I kind of went into how concussions are diagnosed, but then post-concussion syndrome is where, and were you going to say something else?
No, go ahead.
Is basically where somebody has a concussion and their symptoms don't go away, and those can be a list of symptoms about 20 bullet points long. In essence, lots of times involve headaches, dizziness, brain fog, poor memory, poor concentration, depression, anxiety. I mean, it just goes on and on and on and on. And basically, if you're having any of those symptoms, as Dr. Rutherford describes, basically just feeling off, like not yourself, and they continue on after your concussion, then you probably have something called post-concussion syndrome, which is now an accepted term in the literature, even though it still comes against criticism. More and more authors are now saying, okay, this is a real entity. The hard thing with concussion, really this is not necessarily unique to concussion in neurology, is that there's not a biomarker. For hypothyroidism, we have a lab test that says you have hypothyroidism. We don't really have that for concussion. Trust me, they've looked for that. They've looked to see, there's something called, I think it's S-100 beta, where it's a little protein basically in our brain cells, and they're looking to see, can we track that in the blood to see if the brain tissue has broken down. Not very accurate.
So people are going to say, well, what about MRIs and CAT scans?
You know, MRI, that is really early in its evolution as well in terms of identifying concussion. They're really trying to figure out, okay, can we do an MRI in such a fashion with a certain type of enhancing chemical to really identify a concussion versus a non-concussion? And I did not really see a lot of convincing evidence. There's some preliminary evidence that is exciting, but no convincing evidence yet that we have a test right now that is widely acceptable in most hospitals to identify concussion versus no concussion.
Now, you talked earlier when we talked prior to getting on the air here about risk factors.
Yes.
Are there factors that predispose people to having more concussive syndrome or not having it, or how does that work?
They've especially looked at this in the pediatric population, where if someone has anxiety, depression, or migraine headaches before incurring a concussion, they are much more likely to develop post-concussion syndrome. Now, possibly what's going on, and Dr. Rutherford and I were discussing this before we began talking today, is that they're looking at problems with the immune system as well as the energy-producing parts of our brain cells with concussion. So basically, you know, we described, what were you going to say?
Okay, no.
If I'm getting too complex.
No, not at all.
Basically, as we described with the post-concussion syndrome, you're dizzy, you have a headache, you have poor memory, you can't concentrate. Well, part of the thought process here is that the energy-producing parts of your brain cells are not working. They're termed mitochondria. There's a possibility that some people, well, we know some people, especially with those disorders of like anxiety, depression, migraines, in our experience, have problems with their mitochondria where they can't make enough energy. Sometimes that can be secondary to the immune system inflaming.
I was going to say, so that opens it wide up.
It opens it way up.
Risk factors, that goes into infections,
inflammatory disorders, autoimmune disorders, things that are not necessarily completely talked about yet in the neurological literature. It's early on. As we've talked about before in these broadcasts, is that we're seeing things clinically that possibly may not be in the literature for another 10 to 20 years. And it's exciting when we do see stuff in the literature that's very congruent with what we're observing, because, you know, we're saying, okay, what we thought was true is true.
Right.
But with all that being said, basically, going back to the post-concussion syndrome, is that we want to look at the mitochondria, the ability to make energy in the brain, and if you have poor energy-producing ability before concussion, then after you incur the concussion, which can damage the mitochondria further, basically that may be why the person's not coming out of it. And they did those studies on rats. Basically, they just cracked their skull with a hammer, and they went and they looked at their mitochondria, saw that they were messed up. Sorry for all you PETA fans out there. We're very empathetic to animals too. So But anyways, that's how those studies were conducted.
Wow. Okay, so there are a lot of risk factors. So is there not unlike other diseases? If you're vulnerable, you have an autoimmune problem.
And that's what I'm sorry to interject, but the neurosurgeon for the Pittsburgh Steelers, he came out with the article in 2012 talking about exactly that. He said, I think these people are not recovering from concussions who don't because they have inflammatory problems in their brain.
And that makes sense.
Yeah, which are probably secondary to some sort of immunological disturbance. And in essence, for those of you who have not watched us a lot, we talk extensively about the immune system and the autoimmune epidemic in our population, where now it's estimated that maybe 1 out of 6 individuals have some form of autoimmune issue going on, which is where their immune system attacks them, or it may not just be attacking them, it just may be inflamed, and that inflammation, unfortunately, can affect the brain. Dr. Sapolsky, who is the world's foremost researcher on the effects of stress on the brain, has talked extensively about how Hashimoto's thyroiditis, which is a very common immune condition to the thyroid, that in and of itself, that immune inflammation can go into our brain cells and cause a person to feel depressed.
Oh, really? Now you're getting into pretty much everything. Yeah. For example, I know in the East, we do a lot of work with the GI system, the gut, the small intestine, so on and so forth, because if you have inflammation in your intestines, if you have celiac, which is an allergy to gluten, even if you have food allergies, then what you're saying would indicate anything here that's going to inflame the brain is going to perpetuate a concussive factor.
Yeah.
And although there might be neurology developed that if you don't deal with the rest of the physiology, then you're going to have either a short-term or no response.
Mm-hmm. That's basically what we feel.
He's the expert on.
I'm not the expert.
Well, he's not the expert. We can't say it, but Dr. Gates is a board-certified chiropractic neurologist, and this is what they do. They work with the functional mechanisms of the brain to correct them, to derive certain outcomes, and those outcomes frequently will help with a large variety of chronic pain issues as well as specific neurological issues. And in doing so, we've seen success in concussion patients, and that's why we thought we would do this and kind of share with you what we're finding, because it's not out there. It's just something that is kind of evolving in our office for us. It's evolving as we try different things and we see what's successful and what's not. And so that might lead us to what are the current medical treatments, or did you want to cover something else?
I just wanted to interject one patient history. So we have this patient right now, and she is a very high functioning individual, graduated from a very prestigious university with a master's degree. She did it in like a year or something incredible. So anyways, she incurred her second concussion. And after that, she lost her mathematical capability. And she's actually working in finance, as well as she has a corporation that they're taking public. You know, she's probably going to be a billionaire here in about a month. But she couldn't do math. And here's an incredibly bright individual. After her second concussion, the first one basically occurred after skiing, the second one after another head injury. And as we took her through the process, one of the key factors we saw for her was what's termed mitochondrial stabilization. And so we have a supplement that we use that is really powerful at stabilizing the mitochondria. And that, in conjunction with her, what we term neurological exercises, we're going to get into this in a couple minutes. Basically, they're designed to basically bring her brain back online, to exercise her brain, but at a slow and gentle rate. Now she's completely functional. She's working 16 to 18 hours again as of our last conversation. She was just incredibly grateful. And it's just a really neat example of what is possible for a post-concussion syndrome patient, somebody who went from being completely high functioning to then couldn't do 2 + 2, and now is back on track after these therapies were brought in. And it wasn't as though this was just by happenstance. I mean, she was not doing well for quite some time until she came to us. And so for all of the naysayers out there, you know, maybe it's just placebo, and maybe it is placebo, but as Dr. Carrick says, he said, I must just be really good at inducing placebo.
Yeah. Dr. Carrick is the gentleman who developed many of these techniques in the brain exercise rehab model.
Yeah, and we have to credit him because he has figured a lot of this out, and we're going to get into that. Relative to current medical treatments, there just is not a lot out there. We talked about hyperbaric oxygen therapy. That gained some acceptance. That data came out of Israel.
Forces oxygen into the mitochondria.
Exactly, and they thought, hey, this is going to work well. It came from Israel, where obviously there are a lot of bombings, and some of the soldiers over there unfortunately get exposed to those bombings.
That's correct.
But then they repeated the studies in the U.S. and basically they didn't see that it was more effective than sham procedure. There's another few articles I think I attached. I can't remember the name of the compound. I think it was enzogolig or something like that. It's basically an antioxidant. And they saw some promising data. It's a bioflavonoid that helped to reduce inflammation, possibly help post-concussion syndrome patients.
So you're talking about things that would address those issues that we talked about that were predisposing factors.
Right, exactly.
But there's going to be so many factors that are involved with stopping your brain from coming back that to hit just one thing like that is probably not going to be successful.
In our opinion, no, and that's why we don't do it that way.
Yeah.
In other current medical treatments, you can PubMed search it. There just wasn't a ton out there on the post-concussion syndrome patients. Basically, it's just symptomatic management. So if you have headaches, they're going to treat your headaches. If you have dizziness, they're going to give you medications for your dizziness. So very interesting stuff.
Yeah, so there's not much out there, which is why they're going to do the international conference and so on and so forth.
Yeah, which I had the privilege of attending the American Academy of Neurology conference when their concussion guidelines came out. I actually got to hear the top speaker on concussion and some of his honesty in what they were dealing with and trying to figure this out and help the NFL players and the hockey players. And basically the collaboration of different professionals. You have the neuropsychologists who have their screening methods for basically testing people how they can think and how they can react from a cognitive standpoint. It's called the impact questionnaire versus the standard neurological evaluations versus neurosurgeons. It was an interesting conference, but that's where some of these opinions that we're talking about are coming from. But let's get into functional treatments.
Okay, so now we're going to get into some of the treatments that seem to have some legs. They seem to work. They seem to work pretty consistently. Functional treatments. I'm a functional medicine doctor. I don't really like that term.
But you're
not a medical doctor. I'm a certified functional medicine doctor, which means I've gone through the courses. I've passed exams and so on and so forth. A lot of folks today are taking a couple courses and saying they're functional medicine doctors. We're not medicine, though. It's just functional medicine doctor. And Dr. Gates works with functional neurology. What it means is we're looking back to what's not functioning right, what's not working right, and why. Now, that may seem rather simplistic, but our model today is find a symptom and fix it with or address it with a medication or surgery. That's pretty much the general model that we have in this country. It's an acute pain model. When you have a concussion and you've had it for more than a couple of weeks, that's a chronic problem. And what functional medicine does is look at the abnormal patterns that are going on, functional neurology, abnormal patterns in the brain, find out how to strengthen those patterns, how to suppress those patterns if they need to be suppressed, generally without drugs. And functional medicine looks at all of the other things that Dr. Gates talked about as predisposing factors. What is creating inflammation that might be damaging these mitochondria that might not be allowing your brain to rehabilitate itself from this concussion? Because your brain's trying to fix itself. It's trying to fix itself every second that you're sitting there, but it may be so damaged that it just can't quite fix itself, or there may be so many other factors that are stopping those mitochondria from working that it can't rev up the energy to allow the mechanism to fix your brain. I hope that was clear. But that's what we're going to talk about now. So functional treatments for abnormally functioning brains due to concussion or post-concussion syndrome.
Okay, and I'm just going to take a step back. It's just as a little example. So we have coupled our two disciplines, if you want to term it, in terms of functional medicine with functional neurology. And functional medicine doctors embrace functional neurology commonly and vice versa. And what we see is, let's say the balance center in your brain is not working. It's called the cerebellum. Well, we can go in and we can stimulate that cerebellum and see if it starts to work better. We can exercise it for all intents and purposes. However, if someone has an underlying metabolic condition and you don't address that metabolic being, let's say, blood sugar, like you can't make enough energy in the cerebellum, like your immune system killing your cerebellum, then you can exercise that cerebellum and probably get some improvement. But it's, in our experience, is not as great as if you address the underlying cause.
Yeah, you don't get a long-term response,
right.
and the brain needs it needs proper oxygen to function. Brain neurons, cells. It needs proper blood sugar, not too high, not too low, not up and down blood sugar. It needs stimulation. If you've been concussed, there's probably a variety of gradients of that too, where you got concussed and you just interfered with the function of it to actual damage to that part of the brain. But if it's been concussed and it's weak, it needs stimulation. You need a muscle. You need to stimulate it to keep it strong. You need to stimulate your brain neurons. And I might add that it needs a lack of inflammation. And there's a lot of things that cause inflammation in the system. So that's what Dr. Gates is talking about. You have to look at all that, calm that down. Especially Dr. Gates mentioned one particular structure called the cerebellum. And it has more neurons in it. It's these two little things at the bottom. Cerebellum means little brain, and they have more neurons in them, if I'm correct. I'm not the brain.
About as many.
About as many.
Of the brain, yeah.
Okay. About as many as the rest of the brain put together, and it uses up a substantial portion of the oxygen and nutrients that go to the brain. So if you're going to the gym and you got a body that's broken versus a brain that's broken, and you're working out and you're trying to build muscle, but you're going home and you're not putting any of the right things in your body, then you're not going to have as good a result. So Dr. Gates is saying if we do these phenomenal brain exercises, and it's interesting because they don't look very difficult, but they're very powerful when performed correctly. If you do these brain exercises based on your specific need, but you're not taking care of the fuel that's going to the brain, or you're allowing it to be inflamed, you might get a short-term response, but you're not going to get a long-term response.
Right, and that is where the critics of this is called neuroplasticity, where we exercise the brain. That's where they came in and they criticized neuroplasticity-based treatments because they said, well, lots of times these interventions are not long-lasting. And we have observed sometimes that is true, sometimes not. Lots of times if there isn't an underlying metabolic condition, the person can come back pretty easily if you maybe just change their diet a little bit. But if there are the things that you're talking about going on, mitochondrial problems, autoimmune problems, then in our experience we get better results by addressing that with the brain-based rehab. And in essence what we see with concussion, and I have to credit Dr. Carrick, you can look him up. He has the Carrick Brain Center. He's an incredibly bright man.
How do you spell?
Carrick. And he has gone into the world. He definitely worked with a lot of patients who have balance disorders. I would say early in his career, I think that would be fair. He's gone on to work with patients of every type of neurological disorder. But he's definitely nailed concussions in our opinion. He has done that by focusing on eye movements as well as postural responses. And in essence,
for you hockey fans, he's the doctor who got Sidney Crosby back on the rink a couple of years ago after Crosby had gone to all the top neurological centers in the world. Finally, Crosby said, I'm out of here. Nothing's happening. I'm going to see this guy.
He's back on the ice
1 month.
And then he got another concussion, which was unfortunate.
But 1 month he had, because he had a cerebellar concussion that they poo-pooed, that they said didn't exist.
Right. Yeah. Which is, that's what's talked about in the
So he's the man.
He is, and he basically has figured out when we have a concussion, as we talked about, when the brain gets compressed or sheared, basically certain parts of the brain can kind of go offline for all intents and purposes. Sometimes the frontal lobe will go down. Maybe it's one frontal lobe, and maybe one side of the cerebellum, which is the balance center, may get kind of thrown off in how they are communicating. And then he very specifically figured out how we can test for that, which I think needs to be emphasized. And I attached an article where they were talking about testing for eye movements in concussion patients. The testing for concussion patients is not astound, in my opinion. You can look up the balance error scoring system, which is basically any one of you out there watching this.
Shaking my head as a patient now.
Can do this. And Dr. Carrick took it to the nth degree, basically, in figuring out okay, how can we precisely look at how the eyes move? And you probably would say, well, eye movement's a big deal. Well, it's a huge deal because eye movements are one of the most well mapped out researched parts of brain function on the face of the planet. There's a phenomenal book out there for any of you who are curious termed The Neurology of Eye Movements. And each textbook or each chapter has close to 1,000 references behind it. So this is not just woo-woo stuff or fairy dust type of procedures. This is well-researched, hard data. So anyways, he has taken these eye movements in concussed patients and basically figured out how their eye movements are off, and then he can give them exercises to rehab the mechanisms in the brain that control how the eyes move, as well as how the balance center incorporates into that. And basically, it's kind of like taking your car that's out of alignment and getting it back into alignment. And all of a sudden, the dizziness can go away, the headaches can start to go away, thinking becomes more clear, because you have to realize that your balance center talks to your frontal lobe, where your thinking comes from, 12 to 14 times a second. So if one of those areas of your brain goes offline, then maybe the other area of your brain goes offline.
So if you've developed personality disorders after your concussion,
right?
Frontal lobe.
A concussion or depression is seen with these NFL football players. Emotional ability.
And they can get better.
Yeah.
And they can get better.
And they can get better. So again, to summarize, basically bringing your brain back into alignment by re-exercising it. Think of the car out of alignment, basically re-exercising the brain. Couple that with the metabolically based treatments, which may be the underlying reason why somebody develops post-concussion syndrome, because they can't make enough energy in their brain, or they have immune problems that are inflaming their brain.
And it would be understandable if you didn't put together the fact that your bad gut or your bad thyroid or your blood sugar was now causing your brain not to come back from these weird symptoms that you're getting from a concussion. Yeah. But that's kind of the lay language of what Dr. Gates is saying relative to all these other things that are predisposing you and perpetuating your concussion. Yeah, so you got to take care of it all.
You got to take care of it.
Really.
And I think it's great that the NFL is doing what they're doing. I think the NCAA really needs to get on board with this even more as well. I mentioned my friend who was a professional football player. Hopefully you're watching out there, my good buddy, and I won't say your name. But he was talking about how he felt that there was actually even more contact in college in their practices, and how he incurred more head injuries in college even than in the NFL. Which
they are talking about that though. The local coach,
good.
The local coach. We're here in Nevada, University of Nevada, Reno. We have a new coach, Bill Polian, whose parents, whose father and uncles are rather well known.
Wait, is it Mike Scott Polian that's here, and then Bill Polian is his dad? I'm sorry.
Yeah, no, it's Brian Polian.
Brian, okay.
We got Brian. Anyway, the bottom line is he's connected into the NFL. He was lamenting the other day that they may have to start doing practices with less contact, and he didn't sound happy about it. So, so your friend was probably right. But to get back on the subject, if you have had some sort of a trauma lately, listen, you could have a trip and fall and hit your head up against a tree, or hit your head on if you just tuned in, you could hit your head on a beam. I can't tell you the number of pages I've had say, "Wow, I was in this," and I went to go. I was in the house and I was looking into the attic, and I went like that, and I hit my head on the beam, or a car accident. Even if you didn't hit your head on anything, and you're feeling woozy, and you're having some of these symptoms of balance or lightheaded, or you just don't feel oriented, you should get checked out. It comes down to you need a comprehensive neurological exam by someone who understands concussions. And then preferably they would be conversant with functional medicine, or now you're conversant with functional medicine. And not to be promoting, if you've watched our videos, we're not like big promoters or anything like that, but you would probably want to find a functional board certified functional neurologist.
Board certified chiropractic neurologist.
Yeah, board certified chiropractic. We've only been together 5 years. You'd think I would be able to say that by now. But I mean, really, that's the pathway. I mean, I know he won't say it, but I'm saying it because that's what helped me. and 8 concussions can take their toll. And I've had 3 really severe ones that I can see in retrospect kind of changed my life path each time. And I didn't realize that until we started to do this work, and I started to get treated, and then I started to understand what had happened back then. So there are effective treatments out there for concussions. I don't think that they're going to be in the general mainstream acute pain model anytime soon, because usually once you start looking for something in that model, it'll take maybe up to 15 years to come up with something that is workable. And in general, we're usually looking first at drugs, and we're looking at surgeries, and we're looking at electrical inputs and things of that nature. So if hopefully if you have a concussion and you've been watching this, that would be kind of the takeaway message. Get checked, find out what's going on, and find out if it looks like you have a concussion based on a neurological exam, and then probably find a board-certified chiropractic neurologist to help you out, and maybe a functional medicine doctor too, but certainly a board-certified functional neurologist probably has the most skills at this point in time to give you the potential to have some help. So I think, is that good?
I think that's great.
Is that
we
it?
covered
You cover everything you want to
nuts
cover?
and bolts, and
Okay.
again, it's like most of our topics. We could probably go on for 25 hours, but we don't need to.
Well, we've been going on for about 45 minutes, and that's probably way enough. And I would say we will wrap this up. I hope that that was helpful. If you have any questions specifically about concussions, the fact that you may have a concussion or whatever, you can reach us at powerhealthtalk.com. You can email us. Dr. Gates will answer any questions that you have. And you can also see us on
Facebook. Yeah, our Power Health
Facebook
link.
And that should wrap it up. So until next time, thank you for being interested, and hope that was helpful.
Thanks for watching.